is an interactive Zoom event which marks World Health Day, and we are here to discuss mental health and the impact of the coronavirus pandemic. My name is James Brown, and I will be moderating this session on this very topical issue. I am a non-executive director for Mental Health First Aid and have recently contributed to the National Children Mental Health Awareness Week with my talk, Beginning Brave Conversations. And we're delighted to have some eminent speakers here this evening. First of all, Lee Dargue, Chair of the Liberal Democrat Health and Care Association. Secondly, Dr. Mohsin Khan, Forensic Psychiatric Doctor and Chair of the Liberal Democratic Campaign for Race Equality, and Professor Kath McCourt, President of the Commonwealth Nurses and Midwives Federation, each of whom will give a short presentation. Trevor Peel exclusively will be looking at the questions, so please direct them to him, which will emerge during the brief presentations. And Dr. Elizabeth Negus will be providing a vote of thanks at the end of the hour. We hope to focus on learning lessons and how to look forward to a future which is positive. A few housekeeping points before we start. This Zoom event will be recorded and will be available on the National Liberal Club YouTube channel following this meeting. And I would like to ask you to turn your videos off and be on mute during the presentations. These are hugely challenging times we're in at present, and there is a need to look after ourselves both physically and mentally. We seem to know how to look after ourselves physically with exercise, fresh air and stretching, but our minds also need stretching in a different way. We know that we have to rest our bodies if we feel physically tired or run down, but our minds can also become tired and overloaded at times. And then there is a need to rest and relax our minds. There is no one more adept at resting and relaxing our minds than our first speaker this evening, who is Lee Dargue. And so I'm now going to hand over to Lee to make our first contribution of the evening. Thank you, Lee.
Thank you very much, James. Great to be with you all tonight. A real privilege to speak with you, so thank you for inviting me. No surprise to anyone who knows Trevor, but he's worked extremely hard getting this event running. So thank you to Trevor again for the invite, but also for all the work you put into this event. So we're talking about mental health today, especially prevalent as it's World Health Day. And for too long, over decades, mental health didn't get the treatment it deserved in terms of being talked about openly in society. And that was not even getting into the problems with service provision, which we still face largely in this country and around the world, but we are at least talking about it now, whereas we hadn't really done so before. So I'd like to really kick off by talking about a few issues. First of all, why should we as Liberals focus on mental health, and why did we do so, certainly as Liberal Democrats in a coalition government, and what did we start? Also looking at linking it to coronavirus, which of course is very present, and what we think the risks are, but also the potential opportunities for the future. We often talk about when things go wrong in mental health, but there are some opportunities that can come as well. And then finally, just a couple of points on the announcement today from the WHO. A couple of the points I thought Dr. Tedros made really well that I want to pick up on at the end. And of course, we've got a Q&A later after the other speakers as well. So for us as Liberals, I think it's quite clear. We want people to be able to live the best version of themselves in life, in whether they're alone or in families, when they go to work, in communities. And of course, it's communities as well that Liberals have long supported and long wanted to foster a spirit of community. And haven't we needed community in the last 12 months, probably more than we've ever done before. And it's really great to see a number of you from across the world tonight on this call. And indeed, we realise that in a global world, community is all of us. It's not just our town or our village, as important as they are. It's all of us together across the world. And certainly in terms of coronavirus, developing the vaccine was an international effort. And the international rollout is, as many have spoken about, including the WHO, not going fast enough or far enough. And indeed, we unfortunately see, and I can say in the UK, this has happened, a bit of sort of vaccine nationalism in a way, where we've kind of hoarded a lot of the vaccine, which has meant other countries haven't had enough of the vaccine to roll out. So it's really important that we recognise that we're a global community and we support each other, especially in times of need like this. It's also the case that health and mental health, physical health, spans across many areas of our life. It's not just healthcare itself. Another passion of mine is education. There are great discussions around the world at the moment around how we get more mental health to be spoken about in schools and colleges, universities, and how we make sure that young people especially get more of the support they need. Just looking back to coalition government, which was 2010 to 2015, seems like a very long time ago now. We had health ministers, so Norman Lamb and Paul Burstow, who between them really kick-started the revolution in politics about talking about mental health. Now, there were many campaigners for years and people in health and care services who had long been calling for mental health to be taken seriously, for proper service provision, for proper funding, and for us to actually talk about it socially. So we didn't start the conversation on mental health, but we certainly made it open to all to talk about in politics, which then spread out across social media and society in general. As mentioned earlier, we do find, unfortunately, that too often we hear about mental health matters when there's been an awful tragedy, be it in service provision, be it in our local communities, young people, old people, everybody in between. We unfortunately only hear about it when there's been a tragedy, but there are some things to look forward to. And indeed, the invite that Trevor put out to us all looked at whether there are opportunities we can try and look to a more positive future for mental health, especially given the coronavirus. And I think other speakers are going to talk a bit more about how this is affecting us in the world of work, which is vitally important. A particular note on young people. So CAMHS as a service, we have child and adolescent mental health service. My personal view, so I'm not speaking for party or group, my personal view is CAMHS is probably no longer fit for purpose. Now, we clearly need the support for young people, but the problem with CAMHS is it famously has issues around funding, but there's also something we call a cliff edge, where at the age of 18, if you're receiving treatment, and 16 if you're not, you suddenly get cast out and told to go and look for adult services and try and find your own way through the system. We unfortunately find that too many young people can't navigate that well, and indeed the system itself isn't working very well. So there are a lot of brilliant new programs around what we call 0 to 25, 0 to 25 years of age. Of course, 25 is still a cliff edge. So really, we want to see mental health provision for anybody at any time of their life. And of course, the liberal creation, the NHS, talked about supporting us from cradle to grave. And that, of course, is what we need with mental health as well. As James said in the introduction, physical health, mental health, they're very much tied together and they're very much reliant on each other. So it's very important that we see mental health on the same footing as physical health. It is the case, of course, though, that unfortunately that's not the case. Around the world, we see disparities in mental health. There are still many countries that don't talk about mental health as openly as we do here in the UK. We've still got a long way to go, but we know a lot of other communities are still sort of waiting for that proper conversation to happen. We still have major problems around funding. We're often told that, oh, you're always asking for money, it's never enough. Well, unfortunately, that's true. We are very, very lucky in this country, and there are other countries around the world that have a public national health service of some description or other. We're immensely proud of our NHS. And indeed, we see recently that the scandalous decision to offer only 1% pay rise to our health and care workers during these times is unforgivable. And we see elements that we think our particular government is going to do a famous U-turn, which we hope is the case. But of course, we are aware that across the world, we have lots of other countries, as I say, that are still sort of waiting to start that conversation, which is really important. And indeed, one thing, just to pick up on what Dr. Tedros said today in his statement from the World Health Organization, is looking to remove the barriers. And I think that's really important, whether it's in primary healthcare, that we certainly need to invest more on. And again, the WHO has called for that. And we need to make sure that those in primary care are getting the proper support they need when they're making referrals. So talking in the UK, we can still be waiting for 18 months to have a referral from a GP in primary care in order to get somebody to have service provision. And of course, that for too many is too long to wait. we have other opportunities. But again, internationally, we see that primary care itself is not getting nearly enough support and funding that we need to give. And shamefully, on behalf of the UK, I will apologise to our international cousins for us deciding to cut our international AIDS funding, which we as Liberals in government managed to get up to the minimum of 0.7% in aid funding, part of which was for health and care across the world. And shamefully, this government that we currently have is deciding to cut that just at the very time when communities need our support more than ever. So we certainly need to see that reversed. And then the final point in closing is really around another point that the World Health Organization talked about today, around health and social protection. Of course, protection, we know as Liberals, isn't just about the time of crisis or a major time of need. It's about giving people protection and security with their health, with their education, with their access to basic services throughout their life, so that they can live their lives the way that they want to. We know that in this country, as well as other countries in the world, we're not nearly where we need to be. But with mental health, I think, you know, a final note to try and end on a positive step. We're seeing more people talk about mental health, and mainly talking about the UK now, where I know more about, that we see more people talking, more people asking for support. The debate is around better support options in the workplace, in the third sector with NGOs. It isn't just about waiting for people to get into a crisis and then look for a health and care service professional, as much as we need those as well. But we really need to make sure that people in the workplace are supported better. The idea that some of you may have heard before, we have this thing called the work-life balance. Well, I think we finally realise now that no such thing exists. Our work lives and our social lives, our community lives, our family lives, they all overlap completely, and mental health is a priority in them all. So again, thank you for coming along this evening. I look forward to the Q&A. I think that's just about on time, so I'll stop there. But certainly we need to be pushing for more conversations around mental health, because we've seen in the UK, the more we talk about it, the more we expose the problems and the more we can look to fix them.
Well, thank you very much indeed, Lee, and you've spoken with great fluency and passion there to us all. And indeed, we should be looking at the preventative side of this situation. And I think those points will be ones we can discuss a little bit later. And of course, here we are actually discussing this issue, and it's something which, say, 10 years ago wouldn't have even been on the agenda. So discussion is happening, but of course, we need to have some action as well. And moving on to a man I know is a man of action, that is Dr. Mohsin Khan. And Mohsin, would you like to make an input? I think you're going to talk a bit more about the international connection. Thank you.
Thank you, James, and thank you, Trevor, for organising all of this event. So I think the main things I wanted to talk about are really the lessons that we can learn, because we're all aware of how tragic the pandemic has been. I, as a psychiatrist, have seen, you know, the really devastating effect it's had on mental health. But there are things that we can learn about how to change our society going forwards. And the three main things I wanted to tackle were, first of all, just the global connection and how we deal with experts in our society. The second was just the effect of being able to work from home, learn from home, and what that might mean for healthcare, housing, work, and education. And the third was the importance of mental health and social care, and how the pandemic's brought that into a fresh highlight, and how we can use that going forwards in our policy work, in our campaigning work. Now, dealing with borders, the lack of borders, and how we're all just globally connected, that's something that's in our hearts of many of us here in the audience. We've seen over the last few years, there's been a big pitch from governments to essentially say, we don't need the rest of the world. We've got our borders, we can shut things off, we can work on our own. And there's also been a bit of a call from some areas of the press, some parts of government sometimes, to essentially say, hey, you don't need experts. And I think one of the refreshing things that we've seen over the past year is actually what happens elsewhere really does affect us here. And we need to be able to collaborate across nations on that. And the other thing, which is a bit more tricky, is yes, expert authority, listening to experts is important, but we also need a way of being able to challenge that without having panic or without affecting the idea of expert authority. I don't think we've worked that out yet, but certainly within my own profession, I've seen there's been quite rightly a lot of concerns sometimes from what civil service or government experts might say, and how we challenge that is something that we got to think about, I think, moving forwards. The second point was around the changes that things like working from home, video conferencing, how we're talking here mean for society. And I think we've not really thought through the real advantages that this can bring to healthcare, to things like having an appointment with myself as a mental health doctor. You know, you don't need to travel long distances necessarily to talk to a specialist. You can do it from home. But then how do you do that in a safe and effective way, and in a way that puts patients at the heart of the decision? The same applies for things like work, education. You know, there are opportunities to blend how much you are somewhere in person and how much you might be virtually, and that can open up barriers for people with autism, or people with certain social anxiety, people with certain disabilities. You know, there's a big range of things that we can explore there, which I think we as a society need to do. The third thing is, we've now realized, when all of us have been stuck indoors at home, not able to see our friends, our relatives, we've had a big collective toll on our mental health and our well-being collectively. And we've realized the importance, I think, of healthcare, of social care, and of how vulnerable we all can be as a society to new things. And I think, rather than viewing that as something terrifying, it's also just about us being aware of it as a society, that this is something which we've come close to experiencing. Some of us have had really negative experiences of it. But now that we all know that, you know, we are all vulnerable together, this matters to us all, how do we translate that into ensuring there's more resources and funding? So I suppose those are the things that I'd just like to throw out there as positives for us in a global society, how we work towards that and how we bring people along on that journey.
Thank you very much, Mohsin. I think the point about vulnerability being on a global scale is something which this last year has brought a realization. And if ever there was a need for international cooperation, something such as this, a pandemic, is one which is certainly will kickstart it. And hopefully we'll be able to build on that. But thank you very much for highlighting a number of areas for us to think about there. And we're very fortunate today to have Professor Kath McCourt with us, who I know has got vast experience around the Commonwealth, and I'd like to ask her to make an input into the discussion. So, Kath.
Thank you very much indeed, James. Thank you. And thank you on behalf of the Commonwealth Nurses and Midwives for inviting us to participate tonight. Obviously, the nurses and midwives around the Commonwealth have recognised the COVID pandemic and its effect on both patients and families, communities, and the profession itself. And we have seen large numbers of people suffering severe illness and also death from the COVID virus, and large numbers of health professionals right across the Commonwealth. But the concerns around mental health are not new for the Commonwealth nurses and midwives. And if you don't mind me perhaps repeating some things about the World Health Organization, but they estimated a number of years ago that 1 in 4 people would suffer the effects of a mental health illness in their lifetime. And they also highlighted that mental health is the 3rd highest cause of disease burden in the world. And it predicted that it was going to be one of the leading disease burdens by 2030. 1/3 of any anticipated spend on non-communicable diseases is on mental health. And it's a common comorbidity with some of the non-communicable diseases, with infectious diseases and poverty. And this recent increase in activity around COVID, I think, has highlighted the particular need around mental health. And the work that the Commonwealth nurses and midwives have been doing in the last 9 years is very, very relevant. It isn't sort of about the day-to-day work that nurses are undertaking and how they are affected as a workforce, but we've been looking at the legislation in the Commonwealth countries and this foundation of what is governing the countries in the Commonwealth and what policies and practice are in place. And much of this really stemmed from the gold standard of mental health legislation, which is the UN Convention of Rights for Persons with Disabilities. And when that was adopted in, well, it was, I think, 2006, and then it came into force in 2008, that the Commonwealth nurses had an opportunity to work with the Indian Law Society. And I'm delighted that there's someone on the call tonight from India. But we worked with the Indian Centre for Mental Health Law and Policy, and we assessed the mental health legislation in the 45 countries of the Commonwealth against the UN Convention. And that research was very, very revealing. It found that the legislation in most Commonwealth countries failed the standard of the UN Convention. And much of it, probably about 20% of Commonwealth member states, their laws were enacted pre-1960, so before the modern medical treatments became available and before many of the international human rights instruments came into force. So the mental health legislation in only 5 Commonwealth countries specifically included provisions for mental health care and that it should be provided on an equal basis with physical health care, and that informed consent of persons with mental disorders for participating in clinical and experimental research was specifically mandated in the mental health legislation in only 5 countries. And the language of the mental health law, in many instances, added a very negative perception to the further stigmatisation of persons with mental health disorders. And the provisions and the protection from cruel, inhumane and degrading treatments were included in only 23 of the countries that were reviewed. And just to give you some examples, the word lunatic is used in the mental health law of 12 countries. The term insane is used in mental health laws in 11 countries. The term idiot in 10 countries. And 2 mental health laws use the term imbecile. Overall, 21 country laws used at least one of the above terms. So what we were going to do about it. So the Commonwealth nurses with the Indian Mental Health Society approached various governments, and we have developed a methodology where we can work in country with the policy leaders in order to help facilitate change. So we often had to work very hard to get government commitment to reform these activities, and we would work through a memorandum of understanding. We had submissions to various governments of an assessment of the country's mental health laws and other relevant legislations. We have worked particularly with the Seychelles, where this new legislation has now been enacted. We've just finished work with Botswana, where the final draft of their new mental health legislation has been submitted to Parliament, and we're currently working in the Bahamas, where the final draft of their legislation is ready for stakeholder consultation. And really, you know, the work that we've been doing is from the ground upwards, including public consultations and education, and then developing and drafting instructions for the new bills to be submitted. So although perhaps nurses and midwives are often just seen as working in clinical settings, we have, through our national nurses associations in country, to be able to influence and to work, but there is so much more to do. We want to empower and to protect and care for clients who have mental health conditions. And in some ways, the pandemic has raised this issue very much more in the UK, as you've already heard from colleagues this evening. And it's about ensuring that we are able to devise ways in which we can work right across the Commonwealth country and improve and establish in-country activities and support the broad range of stakeholders that are essential in order to make these changes. Thank you.
Well, thank you very much indeed, Kath, and you've given us a real insight there into ways forward as well to solving the situation. I think with all three of our speakers, we've had really like a Venn diagram of expertise here, and I think where they've interacted, one of the things we've been able to see is that there is a way forward, but there's got to be cooperation between all the various strands coming together. And the next stage of the evening, what we're going to do is to, having had that good knowledge put forward to us, we will have some questions now. And Trevor, I think you've perhaps had some questions come to you. Would you like to say what ones are burning issues and are bubbling towards the top at the moment?
Thank you very much, James, and thank you to the speakers. That was a fascinating series of presentations. The first question we've got is from Janet Berridge.
So Janet, go ahead, please.
Good evening, everybody. That was indeed a very interesting trio of presentations coming from different aspects. Something I'd like to ask, I was in America, I was in New York 30 years ago, and as I sat in a subway car, a man came on into the subway, and he had two big plastic bags with him, stuffed with belongings, and he shuffled along the carriage, and he was begging, and he went on to the next carriage. And when he'd gone, I said to somebody who was a passenger like me, good grief, you know, what's he doing? He appears to have his entire possessions in two bags, and he's begging, you know, don't you look after people like that in the States? And the person I spoke to said, oh, we got rid of that a few years ago. We decided that we didn't need residential care for people with mental health problems. We'd simply put them in hostels or give them a bed sit, and then they could, you know, they could access health care. But that was the better way of dealing with it. And I remember thinking at the time, good grief, I hope that never happens in the UK. But of course it has. Heaven forbid that we would ever go back to mental asylums or whatever you want to call them, that sort of institution. But surely we're neglecting our duty to people with real mental health problems by not providing more residential care where they could have long-term help. What do the speakers think about that?
Perhaps if I ask Kath first of all.
Well, I think absolutely. I mean, I think the social determinants of health are very, very well documented. And if we do not look after people and help them to understand their own personal contribution to their health and well-being, we will continue to have some of the situations that we do have. It's it is just a continuous battle sometimes, but we have sort of new conditions that perhaps we didn't have 10, 15, 20 years ago emerging. I think someone spoke earlier, Lee mentioned education, and I think the digital divide that we are going to see, that our young people are going to be grossly affected by that. Because if you haven't got 2, 3, 4 computers in your house and laptops, then you haven't had your education. We're not just talking weeks now. You know, we are moving into the second year of a lot of children at really crucial times in their career and not having their education, not being able to make up that time, with children moving from junior to senior schools who can't read. You know, and we are a developed country. You know, I could talk at length about Sierra Leone and how they've recovered from the Ebola crisis, but this is a crisis that is affecting the whole world.
Thank you. Lee, anything to add to that?
Yeah, I absolutely agree with all that, and thank you, Kath and Mohsin, for your talks earlier. Really insightful. Yeah, I think poverty is both absolute and relative poverty is not talked about enough. And I think you rightly say, Kath, we are a developed country. We are the 5th or 6th richest country in the world, Britain, and yet. So I'm calling you from Birmingham here in the UK, and I live in the middle of the city centre. And we are the 2nd biggest city in the whole country. We have the largest local authority in Europe. And yet I only have to walk 15 minutes in that direction. And we've got the 2nd highest rate of child poverty in the whole country, which is an appalling stain on what we're doing. So I think companies, organisations have a duty as well. There is the accreditation for paying people a national living wage, which is higher than what our government calls the living wage. So I think companies and private and public organisations have a duty as well. But really, I just want to pick up on what Kath had said there. I do some work here in the city centre with rough sleepers, and even the language we use around rough sleepers, homeless people. We are currently, through Layla Moran and others, Liberal MPs in Parliament, trying to get a campaign to get rid of what we call the Vagrancy Act. I still hear people talking about vagrants on the streets, and it's just an appalling language and how we talk about these people. And Janet, you mentioned that in pretty much really what you experienced in America. So the language is really important, as it always is on mental health, but we certainly have a duty across society to make sure that people have opportunity and a proper living wage to live on.
Thank you, Lee. Mohsin, would you like your own experiences?
Yes, yeah. I mean, I think, Janet, you've raised a very good point, and I would echo what Kath and Lee have said about prevention. One thing that I'm quite struck by is there's been many moments where I've worked with service users or patients, and we've worked together, we've really got their mental health much better, and then they're on their way out of hospital or out of prison or wherever they are, and then they're faced with homelessness or unemployment or a return to a situation where there's a lot of abuse or substance misuse around them, and it just undoes all of the good work that they've worked on to improve their own mental health. And you often see very much a cycle where you get people better, and then they just have to be returned to situations where they're going to end up being much worse in terms of their mental health. And really, it's about viewing mental health as something that transcends employment, education, universal basic income, to just flag up a Lib Dem policy. And if we can address those, then we can bring in patient choice about where they want to be treated, and is time spent in a mental health hospital really the best thing for them if you can address some of the other things? Because often people come in because they want a respite from what they're experiencing out in the community in terms of, say, being homeless, and there are better alternatives that we could look at across the government departments and across local authorities.
Thank you, Mohsin. I'd just like to bring in Angela Stile, who I know has had vast experience in this area. So Angela, got your hand up.
Yes, I have. This all started with a Trieste experiment, with care in the community. There was an excellent psychiatrist in Italy who was in advance of his time, went to a mental health institution there and decided that the patients did not need to be all dressed in the same uniform, and he could introduce people having their own clothes. He created a village within the area where people could be trained to work, etc. Then care in the community got adopted and it was abused. Because that's when asylums in this country started to be closed down. But instead of using the money that when they sold it off to property developers and creating the environments where patients and people with mental health problems could be helped and within the community, and treated for their their long-term problems with drug misuse and alcohol misuse? And can we not review again from the beginning what was initially meant to happen? I would urge those of you who have influence to re-look at it from where it started. The policy was started with the Trieste experiment.
Okay, thank you very much indeed, Angela, for that knowledgeable input there. We've obviously got a lot of questions here, so if I could ask the questioners to put them directly, then we can try and answer as many as possible in the time. Trevor, the next question, please.
The next question is from Nicholas Watts.
So, Nicholas, you're on.
Thank you, Chair, and Trevor. And some of my points, I think, have been addressed. I was very glad to see them addressed as well. But I'm interested to know how we can best persuade Commonwealth health ministers who are meeting in May and heads who are meeting in June, of course, in Rwanda at the Commonwealth Heads of Government meeting to address really joined up thinking or the integration of environmental issues in relation to health, such as greening of citizen well-being and housing as well, livelihoods, having a job as a key mental health benefit, as well as the need to join health and public health to social protection and social care in a localized approach to policy. I think we've seen in the UK the benefits of local management of public health issues around COVID. And I think this is also tied to a need to engage in interdisciplinary approaches to education and training and to break down silos between responsible ministries. And it's in part trying to get Commonwealth ministers from different ministries to talk to one another and to get outcomes that bring these policy areas together.
Okay, thank you, Nick. So it's really how we can get things working together, linking together. So, Mohsin, you've had time to draw a breath since your last comment?
Yes, I mean, I think Nicholas raises a very good point. I mean, we always want to see joined up thinking between government departments, between health, housing, employment, well-being, and so forth. And I think there are various ways in which we can possibly try to do that. One of them is about thinking about how we measure our outcomes when we're doing anything, whether it's in government, whether it's in an NHS or a hospital trust, whether it's at a local authority, and how we can collectively measure that we're actually doing good. So I think some thinking around that. The other thing is innovation. In the US, you often see a lot of innovation happening in different US states simply because there's 50 US states. And in the UK, we've seen local authorities, charitable organizations, a lot of organizations have to just innovate and work together, create some of those networks that didn't exist before, simply because there's a failure at times of national leadership. And I think some of those human relationships can be carried forwards and help with international, cross-national, Commonwealth collaboration.
Thank you, Mohsin. Lee, anything to add to that?
Yeah, some small issues you've raised there, Nicholas, but all the very right ones. I think one of the things I've learned going into different settings around health, but also education and being a politician as well, is that working together, the best thing to do is find something that you all commonly share, because we of course all have things that we have different focuses on, we have different attitudes in different countries on all sorts of social issues. But I really think that one of the things to do, and you rightly mentioned heads of state, heads of Commonwealths, also ministers of government, is really following what we try to do in government here, largely through the work of Norman Lamb, is that we wanted to get mental health talked about in all departments, that mental health shouldn't be a silo, that mental health shouldn't be something that is only talked about in the health department, or as Mohsin quite rightly raised, that we also need to do more of it in social care as well. And I think that if we get the heads of government to realise that mental health, and indeed other aspects of health and certainly public health, need to be talked about in all areas. You know, we've mentioned education, but transport, environment, you know, all of these departments have a vested interest in making sure that mental health is on the agenda. So I would, if I could challenge anybody who has the ear of ministers or governments around the world, is to get them to consider mental health across the different departments and try and have a real joined up approach.
Thank you. Infrastructure is a good word here, I think.
Yeah,
so, Kath, sorry to bring you on as number 3 here, but anything to add?
Well, I think, hi Nicholas, it's lovely to see you, and a very, very broad question. I think there is something though about the work that the WHO are trying to do around universal health coverage, because I think if we can focus on some of those universal issues and the delivery of services in the Commonwealth countries, then inevitably we aren't just looking at physical health, we're looking at physical and mental health, and also the collaboration between professionals, that we aren't just talking to one group of health professionals, and recognising that there are huge contributions from a whole variety of professionals that will enhance well-being and the feelings that people individually have about their own responsibility as well to their health. So I think it is a multifaceted sort of answer, but it is, I think, you know, those are the things that will sort of work towards what ministers want and what they want to be seen to have achieved in their own country. I think that you're right, you have to find things that are going to really trigger their interest.
Thank you very much, Nick, for your question. Trevor.
Yes, the next questioner is from Gibraltar, Professor Ian Peate.
Ian, good evening, Professor, and thank you for coming all the way from Gibraltar to talk to us this evening. Could we have your question, please? Is he stuck on the rock at the moment?
I am still on the rock, and I'm having just some problems with the technology. So if we...
You're coming through loud and clear.
Thank you very much for your presentations. I have a question. I suspect the question is to Professor McCourt, really. Kath, I'm wondering, given we're talking about preventing people from working in silos, and given there's a big push for parity of esteem, the Nursing and Midwifery Council, and forgive me colleagues who are not UK based, the Nursing and Midwifery Council are the regulator for nurses and midwives in the United Kingdom, and in their wisdom had decided to provide a pre-registration undergraduate nursing courses that were based on children's nursing, learning disabilities nursing, mental health nursing, and child nursing. So there were 4 fields of nursing, and these 4 fields of nursing, so the undergraduate nurse comes out of a 3-year program and then specialises in either one. Do you think, Kath, what's your thoughts, that there should really have been possibly one generic program?
Yes, well, speaking very personally, Ian, it's lovely to see you. I do agree, because I think we have historically caused some of these silos of thinking that mental health nurses only deal with mental health patients, and you know, that includes patients with learning disabilities as well. And you know, if you have a children's nurse, they only deal with, you know, children, and yet in reality, you know, a good general nurse, which I have to admit, unfortunately, that's what I trained as, you had a much broader breadth. And although we have been for years part of the European Union's guidance on nurse education, not every country in Europe have mental health nurses and children's nurses. So we have always been a little bit out of sync. And I think it would be worth revisiting. And I know often the Nurses and Midwives Council has revisited this. They've done consultations, but people sometimes like to have what they know, and they will represent their field of nursing very strongly. But I think we would probably, as we move forward, be better placed if we had a much more generic programme that was a much more holistic approach, rather than compartmentalising different conditions, because we are, you know, we don't have just legs and arms and hearts and lungs. We are one holistic individual, or a community, and I think we have to function in that way to move forward. Otherwise we will maintain some of these silos that have not really helped us in the past.
Thank you, Kath. Anything to add to that, Lee and Mohsin? Yeah. Okay. Yeah.
I would add that, I mean, I would echo what Kath has said, and the other thing I would add is that essentially with mental health and well-being, you encounter that in all sorts of areas, and it's not always attached with a label of this person has a mental illness or a mental disorder, this person's been seen by a mental health professional. And so I would always be very much in favour for a more general, broad base of education in nursing. I'm aware that I'm obviously speaking as a doctor, and so I should possibly be a bit careful. And the other thing is, I think, again, with the pandemic, we have seen how it touches so many of us and how you do need those skills across all the different areas. And you can never just think of yourself as just one particular thing.
Okay.
Yeah, I think I would only add really that from a sort of more general point, obviously I'm following two professors and a doctor here, but I'll talk more generally about training in that, you know, a lot of the people I've spoken to in private healthcare in the NHS and other organisations is there is a constant debate around, is the training, are the people professional enough when they get onto a ward or get into their training, or are they not? Are they too professional? Have they had too much academic learning and not enough practical? And I know there's always quite a debate, and I have a background in teaching, and certainly I know that's something that's often talked about, and it's always got to be a difficult balance, hasn't it? Of what Mohsin and Kath have said there, again, they are the experts in the fields, not me, but of the general points that I would agree with in terms of a broader based approach. And really just a final point on my day job involves occupational health, and I too often find with occupational health professionals as well is that there's you know, even a quick fill this form in, and it's a copy of a form they've had for years, and there often seems to be that lack of kind of personal approach. And of course, whilst we have lots of data and experience on, you know, lots of different health conditions, it's also the case that, you know, as Kath, you've said many times tonight, it's a holistic view. The person is also their own unique thing as well, and we have to make sure that we're looking at their own needs as well. So it's a very complicated area, but yeah, a really important question.
Thank you very much, Ian. Can I just say how much the Commonwealth and European group, when we visited the University of Gibraltar, enjoyed our tour there by you and seeing your facilities. Trevor, another question, please.
Thank you very much, James. The next question is from our colleague, Sandy Damm.
Sandy, welcome. Go ahead.
Good evening. Actually, I have two questions. The first one is, how can I, as an individual, just help other people or show other people that I'm open to listen to that sort of mental health problems we have discussed? Because we're on the second question is something which is probably more from my background. We have spoken a lot about education on public organizations. How can company directors of smaller companies, small and medium-sized companies, just be more aware or more enrich of people who would have such issues in organization? And I said, in small organizations where you don't necessarily have a HR department or you have specialists all around like multinationals do have. And I would just like to highlight that the SMEs, that's over 65% of the businesses. So open question.
Thank you, Sandy. Lee, would you like to start this one off, please? Thank you.
Sure, thank you, Sandy. Yeah, that really important points. I'm going to kind of almost cover both of them in one go or one attempt. What can you do to help? Also is what directors can do as well in their businesses. And this is the general you. I'd imagine you do this already, but certainly what you can advise you know, other people to do is, if you stop somebody and ask them how they are, really listen to the response. Listen to what they're telling you and what they're saying. Now, you may not be able to give a full chapter and verse response, but just really hearing them, because we have a tendency to say, how are you? Okay, oh, okay, and off we go. And of course, that's not forming relationships. It's not forming communities. Now, in a workplace, for example, you're not going to be there to be friends with everybody. But yeah, really listening to a response and waiting to hear what somebody has to say, I think is the thing I find consistently helps, you know, generate that community spirit. And then in the workplace, yeah, it's difficult when you've got smaller businesses who can't afford, certainly in-house HR, occupational health, and it's quite difficult to provide such a service. But again, the more they talk with each other, of course, they are not professionals, but they're almost acting as a support network as well. So, and of course, the more we talk about it, the more we reduce the stigma. So yeah, talking about it as much as possible. But of course, only as much as people are comfortable with. Really important question, Sandy. Thank you.
Kath, would you like to contribute towards this?
Yes, well, obviously I'm not a chief exec of a small medium enterprise or anything. I think for me, what I've seen over my career is that it's important to really be able to take the temperature or the culture of an organisation, even a small organisation, to know that you are, as Lee said about listening, but I think also to give some structure to some of that listening, because if you have mentorship or coaching for your staff, that gives a designated time where those conversations can sometimes take place where they perhaps wouldn't normally take place. I think there's also, if there are any occasions in the workplace where there is a stressful situation, that there's an opportunity to have some downtime, to debrief, to allow people to talk about it. And I think to be genuine about some of those things, because people will very quickly see if people are being disingenuous and not really meaning what they're saying. So it's really important that people live and breathe what it is they truly believe in, and that the rest of the staff can see that relationship building from there. And I think it was something someone said earlier about work-life balance. Perhaps you need to stress it's life-work balance rather than work-life. So I think it is about how you act it out and how you really believe in your values and in your organisation. So there's lots of probably organisational development jargon that would fit into all of that, but I think it is achievable, Sandy. Thank you for a very interesting question.
Thank you, Kath. And finally, Mohsin, you've got a minute to answer.
So that's a very good question, and there's a lot I could say. I think as an individual and also as a small business owner, as a small enterprise, you in many ways have a lot more scope to do things than a larger organisation might do, and to really set the culture where you've got a culture that an organisation actually does care and isn't just paying lip service. Specific things, mental health first aid courses. Some people like it, some people don't like it, but that can be helpful in terms of how to open those conversations. Challenge your colleagues if you hear things that are inappropriate or out of date. And sometimes this can be well-meaning things. So people can be a little bit concerned about employing someone or giving someone a tough project, and they might make assumptions that, oh, you've had some time off before, you might not be able to cope with this. Sometimes that needs a bit of challenging. And the other thing I would say is think about who knows what in an organisation, so that people can have privacy if they want it, but also openness. And just think about how you can be more flexible in terms of being able to work from home, or having a later opening time, or adjusting times, or giving people the flexibility to be able to take leave without having to tell you clearly what the reason is.
Okay, thank you very much, Mohsin. I think, Trevor, you said there's one last very quick question, is that right?
Yes, please, James, from John Bryant.
John Bryant. John, could you go ahead, please?
Yes, can you hear me?
Yes, we can hear you. Thank you.
My question is, I read today that around 30% of people who have suffered from COVID have subsequently developed a mental health problem, ranging from depression to psychosis. Now, how confident are the panelists in expecting the UK government to do what it takes to provide the resources to support this much larger group of people who need support in the coming months? And a second question, if you've got time, what needs to be done internationally to do the same?
Okay, we're running out of time, so I'll quickly run around to the panel and see if they can provide the solution to all this. So Kath, would you like to say something?
I really don't know. Let the specialists do some work and get on with it and give them the funding they need. Because I think, that's a huge question. We don't know, I think, all the longevity issues that are going to develop from COVID. We are seeing them every day. Okay, thank you. Lee?
Yeah, just thank you, John. I think long COVID, we're getting some details about it. Sleep deprivation seems to be a major problem as well, which of course is then a vicious cycle in terms of mental health problems. Do I have confidence in the government? Not really. They're not giving enough funding for the existing services. We brought in 2 waiting time standards for mental health. They aren't being funded properly yet. So I think we've got a real problem coming, and we're having active discussions in this country, you know, politically about whether or not long COVID might be something people may need to claim sort of disability allowance or payments for in the future. So that needs to be on the agenda. Okay. And just a final thank you to everybody in this meeting for coming, and really appreciate your time.
Okay, Mohsin, very quickly.
I think I would say it could be a very long answer, but I'll focus on one thing, which is staffing. I think after the pandemic is over, you might actually see quite a big exodus of healthcare and social care staff. And those are the very people who we need to help address some of this. And so just addressing that, addressing recruitment and retention.
Okay, thank you very much, Mohsin. I'm now going to hand over to Elizabeth Negus, who's going to say a few words of thanks. So, Elizabeth.
Thank you very much, James. Thank you. Well, it's a matter of honor for me that I am proposing a vote of thanks for this extraordinary Zoom event. On behalf of my colleagues at the National Liberal Club Commonwealth Forum and in European Forum, marking World Health Day with mental health and the coronavirus, would first and foremost like to extend a sincere and heartfelt thanks to all the speakers. In no special order, but I'd really like to thank everyone. Lee Dargue, the chair of LDHCA, who gave us an overview of the need for community, for championing mental and physical health in schools and in university, and that the mental health should be taken seriously. To Professor Kath, McCourt, the president of the Commonwealth Nurses and Midwife Federation, thank you for supplying us with the statistics, some of them quite grave and disturbing, but we are very pleased to know that with at least 5 of the Commonwealth countries that you're working with, you have developed a methodology to effect change and reform. I'd also like to thank Dr. Mohsin Khan, who is a forensic psychiatric doctor, for the lessons that we have all learned through COVID-19 and the need for us to collaborate with nations, the importance of health and social care, the more reasons for resources and funding. So far, it's been very inspiring, very powerful talks that have, enlightened all our minds. Last but not least, of course, I hope I've not forgotten anyone. No, but I'd like to really thank our chair and moderator, James Brown, for an excellent coordination of all the speakers. His ease and the composure is second to none. And of course, for Trevor for putting on this brilliant event. So once more, thank you very much. I look forward to meeting all of you again at another event. And now I would hand over to the one and only James Brown for a minute or two. Thank you.
Thank you. Thank you very much, Elizabeth, for that. And I'm just going to tell you about a forthcoming attraction, which is coming up on the 22nd of April, Thursday, 22nd of April, when Emily Robertson is going to talk about global warming. And we're presenting this along with the Commonwealth Human Ecology Council. So a date for your diary there. Thank you very much to the panel for their input tonight and to all the people who have attended. I know we had a lot of questions which we couldn't get to, but I hope you've enjoyed the evening and I look forward to seeing you again soon. So thank you and good night.